Hello everyone, welcome to Pharma Icon, and the today's topic is we need to discuss about the classification of drugs in the pharmacology. Mostly we need to study about the drugs classification in the subject pharmacology. Okay, first, what are the drugs today we are going to discuss? They are mostly drugs which are used to treat the respiratory disorders. Okay, what are the drugs? They are mostly act on the respiratory disorders. In that, first, the respiratory disorders, the first one is drugs for the cough. Okay, first of all, what is cough? Cough is a mostly it is a voluntary or involuntary action. Okay, cough either it is voluntary or involuntary, in which it is mostly our throat is mostly filled with the mucus. Okay, during the cough our throat will be pain. Okay, in which it is mostly due to the presence of microbes, irritants and some of the fluids and mucus which is present in the passage of the breath canal. Okay, and the cough is a reflex action. Okay, cough is a type of reflex action in which is during the cough the rapid expulsion of our air from the lungs. Okay, this is called cough. And what are the drugs used to treat the cough? They are mostly, first of all, pharyngeal demulcent. This is a one type of classification of drugs to treat the cough. What are pharyngeal demulcents? The pharyngeal demulcents are nothing but these are mostly soothing the sore throat. Okay, and they relieves the pain in the throat. Okay, and these are mostly used to treat the dry cough. Pharyngeal demulcents are used to treat the dry cough, and which is reduce the irritation in the pharyngeal mucosa. So that's why the cough will be suppresses. Okay, and how they work? The demulcents are mostly acting as a coating to the upper layer of the throat, that is pharynx, our air passage, and due to that coating they will be reducing the irritation in the throat. Okay, due to that reduce in the irritation the cough will be suppressed, and which is also increase the flow of saliva in the pharynx, and the saliva is acting as a natural demulcent. Okay, due to this natural demulcent these saliva mainly moisten our throat, and which is soothe and protecting the throat. Okay, this is about the pharyngeal demulcents, means they are mostly acting on the pharynx. Okay, and the examples of the drugs under the category of pharyngeal demulcents are lozenges, syrups, glycerin and licorice. These are the four types of drugs under the category of pharyngeal demulcents. Okay, mostly the natural ingredients are used in the pharyngeal demulcents are like honey, syrup and pectin. And how much duration of action the pharyngeal demulcents they work in the body? They are mostly the relief of cough within half an hour. Okay, this is the duration of action of the pharyngeal demulcents. Okay, next, other classification of drugs in the cough, they are expectorants, or these are also called as mucokinetics. Okay, they increase the mucus. What are expectorants? Expectorants are the type of medicine. They are mostly used to treat the cough. Okay, and they are clear the cough in the throat. Okay, next, they are in the body, and the expectorant helps in the conditions like cold and flu. And what are the drugs coming under the expectorant mucokinetics? First are secretion enhancers. What are called secretion enhancers? Secretion enhancers are nothing but the type of drugs. These are mostly increase the production of the bronchial secretion. Okay, bronchial secretion increasing drugs are called secretion enhancers. These are mostly reduces the mucus viscosity in the respiratory tract. Okay, If there is no mucus, there is no production of the cough. Okay. And what are the examples under the secretion enhancers? The drugs like potassium citrate, potassium iodide, guaifenesin, tolublasam, vasaka, and ammonium chloride. These are the drugs coming under the category of secretion enhancers. In that, the natural are mostly tolublasam and vasaka. These are act as a secretion enhancers under the category of expectorants or mucokinetics. And what are mucokinetics? The mucokinetics are nothing but these are the secretion traumotrics, means they are mostly increase the effectiveness of cough and increases the mucociliary clearance, means they reduces the mucus. Okay, clear the mucus throughout the throat. And what are mucolytics? Mucolytics means breakdown of mucus. Lysis means breakdown. What are the drugs coming under the category of mucolytics are bromohexine, ambroxol, acetylcysteine, and carbocysteine. These are the 4 drugs which are coming under the category of mucolytics. And what are mucolytics? Mucolytics are the medication. They are mostly break the mucus to make it easier. Okay, without breaking we cannot remove from the throat. Okay, after the breaking of the mucus only it can be easily expelled out from the body. Okay, these are called mucolytics. Next category of drug under the class of dry coughs, they are mostly adjuvant antitussives. What is mean by adjuvant antitussives? Antitussives are nothing but type of medication. These are mostly used for the treatment of dry cough. Okay, and what are adjuvant? Adjuvant is nothing but a substance which is increase the activity of the another substance. Okay, means these are acting as a catalyst to speed up their action. Okay, these are called adjuvant antitussives. And examples under the category of adjuvant antitussives, what are they? They are bronchodilators, means these increases the dilation activity of the bronchus. Okay, and salbutamol and terbutaline. These are the drugs coming under the category of adjuvant antitussives. So what is an antitussive? Antitussives are cough suppressants. They are mostly reduces the cough activity. Okay, reduces the cough or suppresses the cough. So this is about the antitussives. And next, the next category of drugs under the classification of drugs for the cough, they are mostly antitussives, are also called as a cough center suppressants, means these are suppresses the cough centers from where the cough is originate. That area they can be suppressed by the antitussives. Okay, and examples of antitussives are cough center suppressants are mostly opioids and non-opioids. Okay, and what are cough center suppressants? The cough center suppressants are mostly opioid agonist, and the mechanism of action of cough center suppressants, they mostly suppresses the cough relief at the cough center of the medulla. Okay, in the brain they are mostly reduces the cough. Okay, cough center, what are the enzymes responsible for the cough? They mostly reduces the activity of that cough. Okay, this is about the cough center suppressant. And the examples coming under the opiates category are codeine, ethyl morphine, pholocodone. And what are non-opiates coming under these are noscapine, dextromethorphan, and chlorferidol. Okay, these are the drugs coming under the category of opiates and non-opiates under antitussives, cough center suppressants. And the last one for the dry cough drugs are the antitussives. Cough center suppressants are mostly antihistaminics. What are antihistaminics? And next category is a pulmonary receptor desensitizer. What are antihistaminics? Antihistaminics are the type of medication. They are mostly act against the histamine receptors. Okay, the type of medication used to treat the variety of conditions. Okay, these antihistaminics are mostly used in the treatment of cold and cough. Okay, in that they blocking the effect of histamine to for the production of mucus, okay, blocking the activity of the histamines. So that are called as an antihistaminics. Examples of antihistaminics are what? Chlorpheniramine, diphenhydramine and promethazine. These are the three categories of drugs coming under the antihistaminics. And what are pulmonary receptor desensitizer? They blocking the activity of sensitizing agent, okay. What are pulmonary receptor desensitizers? The pulmonary receptor desensitizers are nothing but they are mostly used to treat the cough throat, okay, which is originates in the bronchi. And what is a drug is pronoxidazine. The brand name is libexin, which is acting as a cough suppress at the desensitizer action, which is mostly reduce the receptors to the cough impulse, okay, which is blocks the activity of the reflex action of the cough, okay. This is about the pronoxidazine. So this is about the classification of the drugs coming under the treatment and prevention of the cough, okay. That's all for this session. Thank you and do subscribe Pharma Icon.